Professor Combes, thank you for joining us. Can you tell us more about the future perspective for ECMO and other extracorporeal support?
I think the future is bright because now we have some evidence coming about the utility of these devices, especially for VV ECMO. There's been many studies published in the past 5-6 years or so showing that there is benefit for those patients who have the technique. We need more evidence for new techniques which are coming up, especially the extracorporeal removal devices. And there's been a few research initiatives, in particular the Supernova trial, which is going to be launched in the coming months. The objective of that study is to show benefit of reducing the stress and strain of mechanical ventilation in patients with ERDS. And this is permitted by an extracorporeal device which is called a CO2 removal device. So this is one of the big story in research in the coming years. And also we will have a research initiative in the cardiology field for especially cardiogenic shock, those patients who have acute MI. Mortality for acute MI is still high. It reaches about 40% in 1 month. So we need to improve the outcome of these patients. And maybe ECMO, I'm sure ECMO can do something in rescuing most of these patients. So this is also going to be one of the research study we aim to launch in the coming months or years.
Can you tell us a little bit more about the ECMONet initiative?
It's very nice. The ECMONet is an initiative of people involved in the research field, both for cardiology patients and also patients who have respiratory failure. And we aim to launch an international research network which should support research initiative in that field. And maybe later on, maybe one of the sponsor and organizer of these big research studies. So it's going to be, I think, very important in the coming years.
We'll hear more about ECMONet at the International Course on ECMO to be held in Paris in 2015.
Oh yeah, sure, because the ECMONet will have a specific days at great meetings like our meeting in Paris next year, and also in the meeting in Canada, the Critical Care Forum in Canada, which is going to be next October, and we'll also have a meeting in Italy. So there's going to be dedicated sessions at these meetings about research and the way we should organize research within the ECMONet and with the support of the ECMONet.
What else can we expect to hear in the program of the International Course on ECMO 2015?
So as usual, we will have a complete overview of the field, the news, what's going on. We will have great speakers from everywhere in the world. And so we'll have a complete update on the latest information on research, but also on the way we treat patients in the ICU. We'll have a nurse program also and a perfusionist program, the way we treat the patient day by day in our departments. And I think it's very important to exchange between all these professionals, medical professionals, and the way we treat patients. The aim is to improve the way we treat patients. And I think it's great to have this kind of exchanges between people in discussions, very fruitful discussions between people at that kind of meeting.
And finally, can you tell us a little bit more about some of the techniques for sharing and teaching and retraining? What are some of the educational aspects that we can expect to recommend?
Attending these kind of meetings is very important, and actually it provides CMA credits. So it's very important to attend these kind of meetings. We also develop other sessions. For example, in La Pitié, we will have an international diploma, which is going to be taught in English for all kind of medical professionals interested in the field of ECMO and other techniques for respiratory and cardiac support. So this is very important. We also need to develop ECMO simulation models, like it has been done in the for flight simulators for pilots. I think it's very important now. It's the way we might teach medicine in the future. We can develop scenarios to deal with all the complicated problems might have with these severe patients with all kind of machines. And we're working on that, and I think it's going to also one of the big progress which might be done in the next future for education, especially for education.